Hello friends. So I'll be talking very briefly on comparison of IV immunoglobulins and plasma exchange. I'm sure many of the listeners would know that IVIG is the most preferred and it is accepted norm for treating Guillain-Barre syndrome. So this is mainly in Guillain-Barre syndrome because intensivists often tend to treat Guillain-Barre syndrome. So one needs to know the evidence that is available with regards to which is better. So wish to acknowledge my colleague Pradeep who helped me develop this content. So there are around 6 studies that are done comparing IV immunoglobulin and plasma exchange. So we'll just look into one big study that came in Lancet. So this was the study that came from the UK group. It came from the group Plasma Exchange Bar Sandoglobulin Guillain-Barre Syndrome Trial Group. So this came in Lancet way back in 1997. But this was the one of the big study which compared pretty much all the three modalities. So here they looked at IV immunoglobulins, plasma exchange, and the combination of IV immunoglobulin and plasma exchange in patients who did not respond only to immunoglobulins. So I'm sure many of the listeners would agree that we give 5 days of immunoglobulins. If they don't respond, then very often plasma exchange is initiated. So we do not know for sure if the traditional initiation of plasma exchange after IVIG fails really helps. So that answer came from this particular study, which really showed that there is no difference even if IVIG is used along with plasma exchange. So this was a study, as you see, involving around close to 400 patients. 136 were in IV immunoglobulin group, 121 in plasma exchange, and 128 where they got immunoglobulins followed by plasma exchange. So here they looked at all the endpoints. The clinical endpoint they looked at was change in disability at the end of 4 weeks by score of 1. So as you see, there was no difference between any of these three groups. So this was pretty much negative study. We did not really favor the combination. And here they looked at patients who got intubated and mechanically ventilated. And as you see, they were pretty much similar, albeit you would see the number trending to be little low in the combination, but none of them attained statistical significance. So it was 22.3% in immunoglobulin, 23.1 in plasma exchange, and combination it was 16.4%. And they looked at median days for discontinuation of the mechanical ventilator. So it took around 26 days for someone to come out of ventilator who was on IVIG, 29 days for someone who went on plasma exchange, and in the combination, it took 18 days. So these numbers are possibly useful for intensivists because when we are prognosticating Guillain-Barre syndrome, very often family would wish to know as to how long the patient would take to recover. So if you see this data, someone who goes on a ventilator, it really takes close to 4 weeks for them to come out of ventilator. So possibly these numbers are useful to determine that many of them possibly would end up needing tracheostomy. And the median days for the patient to walk, if you look at, it takes close to, as you see, 2 months, 51 days in IVIG, 49 days in plasma exchange, and 40 days in combination. And none of them were statistically significant. And when you look at the median days for patient to be discharged from hospital, it took close to around 2 months. So which means to say, this particular study, which came from the UK, which was a multicentric sort of a study, really tells you the type of time frame that we need to have in mind when we are communicating with a patient with GB syndrome, especially in ICU. So anywhere you could keep, all the trainers could keep this ball figure of around close to 2 months it would take for someone to go home from admission time, and it would take close to 1 month for them to come out of ventilator. So that is the time frame that possibly we could keep in mind based on this study, and it may vary a little bit, but so basically most of these patients will have prolonged stay in hospital and ICU. So they looked at, so this is very interesting. So many, if some young individual has got a Guillain-Barre and family is dependent on his work, so the median days to return to work, if you see, it almost took a year in IV immunoglobulin, and plasma exchange it took 290 days and 281 days. Again, there was no statistical significance between any of these three groups. Again, goes on to show that for someone who is actively working and family is dependent on his profession, when someone gets affected with Guillain-Barre syndrome, needing ICU and ventilation, it would take up to a year for them to return back to work. So this is a useful data for us to just keep in mind because we would be dealing with these patients, and it is imperative that we communicate with the family that they are in for a long haul. So that is the whole message out of this. And this is the number of patients who were not able to walk at all in this particular study, 16.5%. So again, it is important to have this figure in mind. Around 15 to 17% you can keep in mind who will not be able to walk at all, despite whatever treatment we initiate. And death happened in around 4 to 5%. So these numbers are good to keep in back of our mind, especially when we deal with Guillain-Barre, to communicate with the family. Around 15 to 17% possibly will not return to their functional ability to walk. And it takes about a year for patients to recover to get back to work, and about 2 months for discharge from the hospital. So those are the good numbers to keep it in mind. And this is a good study which came way back, which really tells there was no difference even if you add plasma exchange. And subsequent studies also concurred with what we find in this particular study. So as I said, there are around 5 to 6 studies. So all these studies were collated in Cochrane review. So this came in 2014, again by the UK group, by the Hughes et al. So this particular review, it is a comprehensive review of all the trials that have happened in Guillain-Barre, comparing IV immunoglobulin and plasma exchange. So here again, they looked at disability improvement of more than one score. So there were 6 studies which looked at disability improvement of more than one score, comparing IV immunoglobulin and plasma exchange. 6 studies, including 567 patients, and disability improvement happened in 607 in IV immunoglobulin group and 562 in plasma exchange group out of 1,000. And as you see, relative risk was 1.08 and confidence interval was statistically not significant. Again, goes on to show between PE and IVIG, there was no difference. And here they looked at death or disability at 1 year. So there was one study which followed the patients up to 1 year in 243 patients. So 163 out of 1,000 patients here, immunoglobulins, the patient died, and 167 in plasma exchange died. And that was also not statistically significant. And there were 3 studies which looked at relapse or treatment fluctuations in 445 patients, out of which 53 patients had relapse in IVIG and 60 in plasma exchange. And again, not statistically significant between these 2 groups. And this is important, which group had a higher discontinuation of treatment. There were 4 studies which looked into discontinuation of treatment in 498 patients. 18 patients in the immunoglobulin group had to discontinue as compared to 128 in plasma exchange. So as you see, patients who are subjected to plasma exchange, discontinuation of treatment is more likely. So this is fairly understandable because of possible logistics and vascular invasive methodology that is adopted to do this plasma exchange, and possibly hemodynamic instability. And this was statistically significant in this particular review. So which means to say IV immunoglobulin is much easier to administer and much more tolerated as opposed to plasma exchange, where discontinuation had to happen in significantly large number of patients. And there were 4 studies, including 388 patients, which looked at adverse events. And as you see, adverse events also tended to be higher in plasma exchange, although it did not attain statistical significance. So this is summarily the evidence that is available when you compare head to head with IVIG and plasma exchange. So Lancet study is a good study which compared 3 arms, IV immunoglobulins, plasma exchange, and the combination. And that is the reference sort of a study we have, where adding plasma exchange after IVIG really did not make a difference. And that study really put the numbers in one's mind as to how much time it takes for someone to get discharged from hospital and get back to their functional ability. So it almost takes a year. So that is something you can keep in mind. And the failure rates of either of these methodology in that particular study showed around 14 to 16%. So when you take all the other smaller studies, around 6 studies, all studies show there is no major difference between IV immunoglobulins and plasma exchange, albeit the tolerance to IV immunoglobulin and the ease of administration and adverse effects seems to be less with IVIG. So that is the summarily that you could keep in mind. So that's about it. Just a brief sort of a overview on comparing IVIG and plasma exchange. So thank you one and all. So you can visit my website to rehear to this lecture. So thank you one and all.